All right. Good evening, everybody, and welcome to Spilling the Tea about hormones. Thank you for joining us this evening. This is such a hot topic, um, no pun intended, among men, among women who are in perimenopause, menopause, postmenopause. If you're like me, you have been through the ringer or maybe going through the ringer or maybe wish that there was somebody that could help you screaming loud that if somebody's out there that can help you. Hopefully um, uh, this session might be able to help and answer some of the questions you may have. So I'm Kathy Davis, your health and wellness coach. I am the founder and CEO of Execute Your Power. And what I do is I help people who are ready to live healthier uh, through active moving, through mindful eating, restful sleep, and effective stress management. So today, the objective of this session is to explain the symptoms associated with imbalanced hormones, the role of cortisol, types of hormone replacement, and hormones in cancer. So a few housekeeping rules before we get started. You are free to ask questions throughout the session. You can place them in the chat or you can raise your hand to be called on. Hold on, I gotta let somebody in here. We ask that you only ask general questions. Uh, this is not the hour for personal consults at this time. So we can do that at a later date. But please try to limit your questions to be very succinct and direct, 10 seconds or less if possible. And then we want to hear from you to share any future topics that you might be interested in. So feel free to add those to the chat box and we'll make sure that we make note of them for future possibilities. So now I want to introduce you to Dr. Poe with Cryo and Contour. Dr. Poe is board certified by the American Academy of Family Medicine and has been practicing medicine since 2008 and specifically related to hormones for the last 4 years. Dr. Poe completed her bachelor's degree in psychology at Fisk University in 2001 and went on to attend Meharry Medical College, where she obtained a master's of science in public health and her medical degree. Prior to opening Cryo and Contour, located in Nolensville, just outside of Nashville, she served as assistant professor for the School of Medicine at Vanderbilt University and as a primary and urgent care physician in the Vanderbilt Health Group Network. So at this time, I'm going to hand it over to Dr. Poe. Let me unmute you I think I got you locked down. Hold on one second. Uh,
There we go.
okay.
Perfect. Thank you so much for the introduction and rules. And all welcome everyone to this information session. So I'm really excited to have a conversation with you all. I am going to really just talk to you guys like I talk to my patients in the office. So it's going to be really relaxed. However, I am going to have some things that are very, how should I say this? Specific, it may be medical. So if you have any questions, need me to break it down further, I definitely will do that. So let's get started. When I am out and people know what I do for a living, they will ask questions and then other people will listen to the questions. And the other person always will say, well, my doctor said my hormones were good. So good, right? My hormones are good. So what does that exactly mean? So when doctors draw lab work, they do what they feel is necessary to order, things that they know how to interpret. And sometimes they avoid doing things that they don't necessarily know how to address because the American Board of Family Physicians or dermatologists or internal medicine has not established a specific rule for the specific labs, right? So when your doctor says that your labs are normal, that means it falls in a range. And so that range can be anywhere on the normal curve. So if you are familiar with what the normal curve is, can you type yes in the chat so I can kind of see who's familiar with that normal curve? And then I'm going to pull up the whiteboard and just like do a little drawing. All right, and do an example. So can everyone see this whiteboard? Okay. So, okay, good, good, good. All right, so this is a normal curve. So if we say, for example, what is the normal hair length? How long is someone's hair for women, right? So we can go all the way down to 0 inches, or we could say 0.1 inches and all the way up to 60 inches, right? So that could be normal. I've seen people walking around with hair to their ankles, right? And I've seen people walking around with shaved heads, right? But if you go to your dermatologist about your hair growth and you say, doctor, I feel like my hair isn't growing, I want my hair to be longer. And they say, oh, well, it's normal. Your hair length is normal. You're like, well, it might be normal, but I want mine to be 12 inches or X amount of length, right? So same thing goes with hormones. So if your hormone level is, let's see, we'll get the eraser. So if your hormone level is, say, six and the 200. So if you fall anywhere between 6 and 200, your hormone level, I'm talking about testosterone right now, your hormone level is normal, right? But if you are having symptoms of low hormones and your level is within this number right here, which is 95% of people fall in this range of the normal curve, then you are not happy, right? You're having hot sweats, night sweats, hot flashes, if the hair is thinning, decreased sex drive, getting tired in the early evening. Usually people say about 2:30, or some people say they got to go to bed by 7 o'clock, or their eyes are just closing on their own, right? So does anybody have any of those symptoms in the chat? Feeling cold feet or hands, or feeling chill when everybody else is normal temperature, weight gain, moodiness, sleepless nights, just waking up at 2 o'clock in the morning, staring at the wall. And then when your alarm clock gets ready to go off, then you fall asleep, right? So those are all symptoms of hormone imbalance. So I'm going to actually take this. Oh, actually, I'm going to do a little bit more drawing. So I do draw in the clinic a lot. I have my little whiteboard. So that's kind of why I brought this whiteboard up to you guys as well, so we can kind of get some images. So normal, people have different hair lengths, right? People have different cells in their body. They have different cell receptor amounts. And so I'm going to just draw a picture here of a cell. This could be any cell. So this is person C, this is person B, and this is person A. So if the cell receptor for your estrogen, sorry, if you have a cell receptor on your cell, it's just waiting right here for the estrogen to come around, and person A has this much estrogen, it's going to be really easy for that estrogen to go into the cell and for their hot flashes to be resolved, right? If a person has that much estrogen, then it might not be as easy. But a person with this much estrogen, it might be hard for them to get the estrogen into the cell because of the cell's affinity, or like magnetism, for that estrogen to get inside of the cell. Okay, so this person A has a normal amount of estrogen, person C has a normal amount of estrogen, normal, but they still might need additional estrogen in a medicine form in order for them to receive the accurate result of their hot flashes going away or their hair thinning or that kind of thing. All right. So anybody have any questions about that? What normal hormones are, hormone levels, okay? So I said I was going to go over the symptoms of the abnormal hormones or hormone imbalance, and I did that. So just to go over them specifically: night sweats, thinning hair, headaches, hot flashes, difficulty concentrating, fatigue in the early evening, increased sensitivity to cold, weight gain, moodiness, vaginal dryness, sleepless nights, decreased sex drive, and foggy thinking. Okay. So it makes me sad when I hear those because I know people are suffering out there with those things and trying to cope. And so sometimes it feels like you're fighting against your own body when you're experiencing those symptoms. And it can very well impact your ability to function throughout the day. Okay. Okay, close that out. So just want to give you a visual of those. Um, let's see, I'm just looking at your, there you go. Okay, so moving on. So with your hormones being out of whack and your doctor not really giving you answers, that's kind of where I come in and draw labs and interpret them into how we can um, make your symptoms go away. So even if your hormone levels are quote unquote normal, you still could potentially benefit from getting additional hormones. However, with the lab draw, I don't specifically just order hormone test. I order a full panel to see why there may be other reasons why you might be having those symptoms. So, for instance, weight gain, right? You could be eating too much. You could not be eating enough. You could be eating the wrong foods, right? It's not necessarily a hormone thing, but I can't evaluate you. And I can't evaluate you and give you hormones for weight gain unless I know that that's specifically what the cause is. So we go into other things outside of just lab tests. Okay. And mentioning eating, we want to talk about why your diet is important in as it relates to hormones. So when we talk about eating, sometimes we will eat certain things, carbs, eat certain things that can positively affect us when our hormones are low. So if we're having difficulty sleeping, it's going to be hard for us to concentrate the next day, right? So if we're not being able to concentrate during work and things like that, then we might eat something sweet to give us a little boost of energy. If you're doing that throughout the day, then that can lead to weight gain. Okay. So there are other aspects that can contribute to these symptoms. So you don't want to get pigeonholed into just, oh, it's my hormones causing this. We want to get the broader picture and see what else might be causing the symptoms before we just narrow down on hormones. Okay. Um, One big thing, other thing, as opposed to the lab test, people are asking about their cortisol level. So actually, cortisol is not one of the labs that I normally get. And so some people may ask me, why are you not testing my cortisol, right? So the cortisol goes up and down throughout the day. You might get into traffic and start getting upset at the person, that cuts you off. Your cortisol can go up. You might be thinking about something that went on, with the argument with someone you had the day before. Cortisol can be up from the day before and still get higher. And so cortisol is what we call the stress hormone. So our bodies, believe it or not, are made to reproduce. Okay. And so the hormones that we typically think about, progesterone, estrogen, testosterone, those are all hormones that help us to reproduce. Okay. But our bodies are not going to reproduce in a stressful environment. So if we're telling our bodies that we're under stress, then our hormones are going to be dysregulated to prevent that from happening. So I'm going to give you another example. I'm not going to draw this time. But so if you are running from a dog, and some people may have heard me say this before, but if you're running from a dog, right? And you're like, your body's like, oh my gosh, you got to get away from that dog because of your safety, right? And so what happens is your body will force sugar into your bloodstream. And the reason for that is because sugar is energy. It goes into the cells. So sugar is going to go into the bloodstream and fat is going to go into the bloodstream to help you to be able to use those two sources of energy to get to the muscle so you can run away, jump over the fence, whatever you have to do to get away from that dog. So I'm using the dog as a stressful event, right? Well, if you're getting away from the dog, it usually takes 5 minutes or less for you to run and get to safety. However, if the dog is I don't like my work environment, or I'm constantly fighting with my husband, or my kids are always getting in trouble at school, or whatever it is over months and years, then your cortisol level is going to be up and it's going to be up for a long period of time. So you can think about that. Blood sugar is going to be high for a long period of time. What does that mean? Anybody know what your blood sugar being high for a long period of time is? You put that in the chat. Your cholesterol or your fat in your bloodstream high for a long period of time. What is that? High cholesterol, diabetes. Exactly. So with stress, it can lead to diabetes. I've diagnosed people with diabetes. It's like, I really don't eat a lot. I don't eat a lot of sugar. And not eating on a regular basis, which a lot of us do when we're stressed, can lead to diabetes. Okay. It also can lead to the cortisol being up, and that's like a domino effect. So the cortisol is up, it it inhibits your it causes inflammation, right? It inhibits your body's ability to make GnRH, and that is a hormone that comes from the hypothalamus that regulates production, and the pituitary gland then stops making so much estrogen and progesterone. So you see people walking around, they're like 70 years old, they look great, they don't look like they have any stress, they don't have belly fat, and that's because they're regulating their stressors. Okay, so we all have different ways of dealing with stress, and I'll talk about some of those things a little bit later, but the stress can actually inhibit your hormone production. And so if you are dealing with stress very well, you have a chef cooking your food for you, and you got a gym in your house or a gym routine, and you got time to go to the gym, and you take a vacation every month, usually your hormones are going to be more balanced than someone who is under stress constantly on a daily basis. Okay. Let's see. What else did I want to say about that? Oh, okay. So, what does it say? Maybe I should retire. Well, you can use your judgment on that one, but stress definitely can impact your health. And so can low hormones. So actually, there's a lot of new research since 2022. There's new research showing that age, which we thought in the past, age was associated with a lot of cancers. They're showing that age is not necessarily the thing that's associated with cancer. It is the hormone levels being low. So if we can build those hormones up with hormone replacement therapy, then we can potentially decrease the cancer risk by strengthening the immune system. So our immune system is what kind of protects us from cancer. And so that's another topic that we need to discuss. What are the effects of low hormones? Okay, so there is a significant list of things that low hormones are associated with. One is being overweight. And I talked about inflammation. So fat cells actually are inflammatories. They cause inflammation. So people have more aches and pains when their levels are low. Diabetes, increased risk of disease mortality. So whatever disease that you actually have, it can increase your risk of dying from that disease. So we can consider, some people are like, man, why did, so-and-so have to die from cancer, but this person, survived. And it's not necessarily, one specific thing, but the hormones do play a role in that. And that's what a lot of the research is coming up to try to figure out how can we use hormones in the treatment of cancers. Alzheimer's is a result of low testosterone, osteoporosis, aggressive prostate cancer, and fatigue. I think that's one of the things that we all like can attest to. It's like fatigue, like I'm just so tired. Like how can I get more? So that's I think was it a lot of the energy drinks can kind of capitalize off of that. And that's why so many people I think drink coffee. So those are some of the things. I just want to stop right there and pause for any questions that might be in the chat before I move on to the next topic.
So come on, guys, don't be shy.
Oh.
Ask those questions out there. I know you got some. Feel free to chime in and let us know what questions you have.
Well, that means I did a good job at explaining.
Okay, so Dr. Poe, one question I have. You said that your doctor, they do your blood work to check your hormones. It doesn't seem like my doctor doesn't do the blood work that specifically dive into female hormones. So should we be asking our, say, primary physician to do those tests to go beyond if we think we're having hormone issues?
That's a good question. So first of all, I've worked really closely, no offense to anybody who's on that's a OBGYN, but I worked really closely with OBGYN doctors and even did some training with them in my early years. And I remember specifically them laughing about, oh my gosh, she thinks it's hormones. Ha ha ha, I'm not testing that. That's not related, right? So I'm not saying that everybody's doctor is going to do that, but I know specifically doctors that do. And then the reason for that was lack of knowledge, right? So if you ask your doctor who did not offer to check your hormones for you, if you ask your doctor to check those and they don't know how to interpret the results, they just go by the lab's interpretation of normal. So when you get your lab results back, it says, this is my number. And then on the side, it says, this is the range of normal, right? So that range of normal actually is what the laboratory sees when people get their labs drawn in that specific region, right? So if you get your labs drawn in California versus New York versus Tennessee, it may be a different range. So it's based on what the lab actually sees. So if I go into the doctor's office and I'm like, oh my gosh, I'm just feeling so tired and my libido is down, doctor, can you draw my hormone levels, right? I'm not going to go in there if I'm feeling good and ask them to draw my hormone levels, right? Because of the fact that that population is a population of people who are having concerns, that's going to skew that range, if that makes sense. So the range that they give on the side is going to be based off of the people who are getting their labs drawn. So it doesn't necessarily mean that, oh, if I'm in this range, there's nothing that can be done for me. So there's still hope. And I actually had specific training in hormone replacement therapy. So before that, I didn't even know what to do with the lab. So I actually sought out additional training to be able to help people achieve the optimal hormone levels. So optimal isn't 200 necessarily on that chart, but it depends on an individual's receptors, right? We talked about like how much is available. Is that receptor sensitive to that particular hormone? How many receptors you have on your cells, that's based on genetics. So a lot of times if your mother went into menopause at a certain age, it may be when her levels got to that point, then she started having symptoms. Usually the daughter will be in the same predicament, around that certain age. So some people, I have patients who have gone into menopause in their early and mid 30s. So I had a patient today who was like, well, my mother went into menopause at 52 and I'm 50 now. So maybe, it's going on that track. However, getting your specific numbers interpreted by someone who knows how to interpret them is going to be the key. Does, does that make sense?
Yes.
And
Yes.
then also that drives me to another point I wanted to bring up is why don't doctors like hormones? Right. So we as doctors, we base our decision-making processes off of research that has been done in the past. And so there is a very popular research study that was in regards to hormones. And that research is called the WHI study. So they took women that were in menopause and they said, hey, this group over here, you're going to get estrogen. This group over here, you're going to get progestin. Notice I didn't say progesterone, right? Progestin. Okay, so this is the same type of synthetic progesterone that is in birth control pills. Okay, so they gave postmenopausal women estrogen and progestin. Okay. And they wanted to see what happened. So two groups, one with just estrogen and one with estrogen and progestin. And they had to stop the study. Why? Why did they have to stop the study? Because people start getting breast cancer. So they were like, oh my gosh, let's stop. We don't want to do any harm. We got to stop this study. We can't give you any hormones. But the people who were getting the estrogen were like, I'm not stopping my estrogen. My hot flashes are I feel good. Right. My skin is looking healthy, has my wrinkles aren't where they were before and all the things. So they were like, well, if you're gonna keep taking it, just make sure we can monitor you so that, you're not getting cancer or, heart disease and things like that. And then they found that these people thrived with their estrogen, right? And so I mentioned estrogen and progestin actually is found in that study to increase the risk of breast cancer. However, doctors and health professionals say hormones cause cancer. That was like the headlines back in the um, 90s, early 2000s. I think it was 2002. Um,
Mm-hmm.
Hormones cause cancer. Hormones cause cancer. So then I was like, oh my gosh, if you want to do, I remember in, with OBGYN doctors, if you want to be on hormones, we can put you on them, but you can't be on them forever. Right. I don't know if anybody has heard that. You can't be on them forever. So I'm going to give you a little bit and then we'll just, like stop them as you get through menopause. So with that, then some people they'll stop them and then they'll get hot flashes and then they want to get back on them. So it's like kind of a back and forth thing. So what I do with my patients is I actually optimize their hormones with estrogen, progesterone, bioidentical progesterone, and testosterone. And so those three have been proven to actually be beneficial in creating a balance and not just giving estrogen in a random amount. So with bioidentical hormones, we can actually give you a specific dosage that's appropriate for you in your numbers. So that's why it's very important to get your labs drawn to see what you actually need, as opposed to giving just, oh, we'll give you 2 milligrams of this estrogen and you should be good, or 1 milligram and we'll see how you do. And if you're okay, then we'll increase it, or that kind of thing. So it's very it's more specific to the individual. And I think a lot of doctors get the word hormones, they put into a group, right? So I had a patient come to me. She's been on hormone replacement therapy with me for over a year. And it was fun. Well, I guess, yeah, it was over a year, but she was late for her annual appointment with her primary care doctor. Um, so she went there and she was like, you know what? I am taking new medication. This is the new medicine I'm on. I'm taking some testosterone replacement. And the doctor was like, oh my gosh, why are you doing this? You're going to be, growing facial hair, your voice is going to get deep, your blood pressure is going to go sky high, and all these, other things. And so my patient was like, okay. And she's like thinking to herself, well, I've been on this for a year. None of that has happened. My blood pressure is actually better. I feel better. And so as I discussed this with her, we're kind of talking about how doctors react. And I think they categorize women taking testosterone, even though it's bioidentical, they categorize that with anabolic steroids. Totally different, right? So you got the anabolic steroids that are synthetic, that are not regulated. People were taking those, like they'll buy them offline or wherever they get them from. And they weren't even getting their labs drawn, and they were causing other side effects. They were not bioidentical. Bioidentical hormones are the molecule on a molecular level is the same as what your own body would produce. So you don't get the side effects that come with the synthetic medications. So that's kind of the difference, because people can kind of get scared because they don't really know the specifics, like progestin versus progesterone, or bioidentical versus anabolic steroids versus synthetic. So,
So you've got several questions in the chat.
okay.
The first one, let's go back to the first one that I saw. It is, how can we effectively improve our stress levels without hormones?
Get rid of the stress. No, I'm just kidding. No, there's no way to get rid of the stress. It's how we visualize and um, receive the stress, right? So it can be on an individual basis, but I'm going to give you some tips. I'm glad you asked that. So 5 things, kind of 6 things that can help with stress that you probably, hopefully your doctor has talked to you about this. Regular exercise, specifically weight training. So if you exercise in an irregular fashion, that could be stressful, right? So just say, for instance, you've been working out on a regular basis, and then you stop, and then you come back to working out, and it's been, a month or more, or even more than 2 weeks, right? And then you think you can go back to that same level you were before. It can actually lead to injury, right? So that's going to be more stress. So number one, be doing it on a regular basis, that actually helps bring your blood pressure down, helps your body to, because exercise can be kind of like a stress on your body, right? But if you do it on a regular basis, it's not as stressful. Your body gets used to seeing your heart rate up, your blood vessels expanding, and all those things. So you want to do that exercise on a regular basis. Plus, exercise is the best medicine for regulating your blood pressure as well. Number 2, eating whole foods. So whole foods, when I say whole foods, I don't mean going to Whole Foods necessarily, but if you look at it and you can name it, right? So if you look at an apple, what is it? It's an apple, right? If you look at the rice, what is it? It's rice. But if you look at a Cheeto, like, you don't know what's in this Cheeto, right? It could be all kinds of chemicals. You look at the name, colors and dyes, that's not necessarily a whole food. So I just say, if you can see it, so you have some chicken, you have some rice, you got, some fruit, those are whole foods that you want to incorporate, nuts, those kinds of things. So you want to be mostly eating whole foods. Sleep. So sleep is very important. It actually helps to balance your hormones. Sleeping, I have people who tell me that they use sleep aids to help them sleep. They can actually contribute to weight gain. So there are 2 that do not. The 2 are melatonin and magnesium. So those 2 can actually help you to sleep more soundly. Having a sleeping routine, of course, is important. Setting priorities helps reduce stress. So saying no, I think that's a big thing that a lot of us don't do. Saying no to people who ask of us when we already have priorities established. If we continue to say yes, that can increase our stress level. um, Vitamin D. So taking vitamin D is a base of a lot of the hormones that we, I'd say base, but like a major component of the hormones. So our body uses vitamin D to make hormones. So if we are low in our vitamin D, we can't make hormones. So you want to have that readily available. So you talk to your doctor about which doses is appropriate for you. And then zinc as well. So zinc can help our bodies to produce appropriate amounts of hormones, including thyroid hormone as well. So
Okay.
next question.
All right. So we have another question. Are there any hormone replacements that are more natural than others?
Yes. So the bioidentical hormones are the most natural. So if you took your own body's hormones and you put under a microscope and figured out what it was made of, that's what bioidentical hormones are. So the lab, or not lab, the pharmacy that I use, they actually use yams to make the bioidentical hormone. And so that's the closest thing that we have to our body's natural production.
Okay. All right. Next question. How does intermittent fasting affect hormones?
So that's a good question. So intermittent fasting. So people get fasting and starving confused, and our body does not get confused off the two. So does anyone know what makes fasting different from starving ourselves? Can you type that in the chat? Anybody know? Let's see. I don't see the question. Nobody knows? All right.
No,
So
nobody's answering.
the difference between fasting and starving is cortisol. So if I told you, like, I'm not gonna let you eat, then you were like, oh my gosh, what? I can't eat. You might not say that at first, but after, day two, you're like, oh, what's going on? So cortisol. So we talked about what cortisol does. Cortisol actually inhibits your body's ability for your brain to make the GnRH, and then that leads to increases your GnRH, decreased level of hormones. And your body can't make the hormones, right? It doesn't, because it's a stressful environment. It's a famine. We cannot bring a kid into this world in a famine. That's what your body's thinking, right? So we got to dysregulate the hormones so that no eggs will be released, so that the person can't get pregnant. But what that means to us is that our hormones are dysregulated, periods might be off, X, Y, and Z. So how do we fast and not starve ourselves? We have to get the appropriate amount of calories in within a 24-hour period. So we have a machine here in our facility that actually tells us how many calories or how much energy your body needs and is storing. And so how many calories do you need in a 24-hour period? For me, that's about 1,550. And so when I fast, I will eat 1,550 calories within the eating window that I provide for myself. So I'm actually getting all the nutrients that I need, even though I'm fasting. So a lot of times I'll hear people say that they're fasting, and in actuality, they are eating less than what their body requires. So like, oh, I fasted for 12 hours, and then I had a salad. And I'm like, okay, well, that's like 400 calories. Like, that's not enough for what your body needs. So your body feels like it's starving, and then your cortisol level goes up. So that's how it works. So if you want to do intermittent fasting, we can have a whole another session about this. But if you want to do intermittent fasting, I could definitely instruct you on how to do that. But the easy way would be to fast 24 or 36 hours instead of fasting. And that would be like once a week instead of fasting like 12 hours, because that's just decreasing your nutrients where your body can't function appropriately.
Okay. So, next question. I was always told hormone therapy caused cancer. Can osteoporosis get better?
You said, I'm sorry, I didn't hear you.
Well, I think you answered the question from the
No,
talking
earlier.
about the study on hormone therapy causing cancer, um, because that's what we were told a long time ago. But I think the latter part is, can osteoporosis get better? I'm assuming she's asking on hormone replacement therapy.
Yes. So actually, the research shows that Osteoporosis, the only thing that can actually reverse osteoporosis is hormone replacement therapy with testosterone, bioidentical testosterone. I've actually seen that significantly improve in my patients. And I think you'll start noticing bone regrowth within 6 months. But with a lot of the commercial medications, very little improvement and increase in bone density on those medications, and they can be dangerous too. Like I know some of them specifically, you cannot lay down after taking the medication because the pill might erode through your esophagus, just different things like that. And so the hormone replacement therapy is actually safer in those cases and more effective.
Okay. Somebody wanted to know how old is the research study that you shared?
The WHI,
Yeah.
I think it was done late 70s.
Yeah, that's old. Yeah.
Mhm. Yeah.
Yeah. Okay. So, if you had a full hysterectomy, do you still have any of your own hormones?
Full hysterectomy, I'm assuming means your ovaries were removed as well as your uterus. So, yes, you do have a little bit. I'm actually going to pull up because I get this question. Maybe, oh, here it is. Pull up the whiteboard. Okay. So, I'm going to talk first about a partial hysterectomy. So if you have your ovaries are here, and then your fallopian tubes are here, and then your uterus is here. Um, you have your ovaries are what make a lot of your estrogen, okay? When someone has a hysterectomy and they leave their ovaries, the doctor will cut there, okay? So we are keeping the ovaries, but we're taking out the uterus. So if we take out the uterus and we're cutting here, we are also cutting off the blood supply. Is there a way to shoot? Oh Lord, bear with me. We're cutting off the blood supply. So I'm just gonna yeah, take it off. So we got blood that comes from the heart to the ovary. Wow, it did that for me. Okay. It was my first time using it. We got blood that comes from the heart to the ovary, right? So I didn't mean to erase it, but yeah, there's our little ovary. Why is it making shapes? Let me take that off. Okay. It won't come off. Anyway, let's start over here. So we got blood vessel that comes over here to the ovary, giving the ovary blood supply. And then we have another artery that comes from the uterus this way. So the ovary is actually getting blood from two places. Okay. So if we cut right here, you can see like a lot of the blood that's normally going to the ovary that helps you to make your estrogen is going away. And so if your ovary is not getting blood flow, then it can't produce as much estrogen as it was before. So my doctor did lie to me because I had a hysterectomy and they told me, oh, your body, your ovaries will just adapt. You'll be fine, it'll be normal. And then 6 months later, I was like, I don't feel normal. I guess the levels kind of got down to the point where my body could recognize it. So your partial hysterectomy, you're actually going to be making less. I say partial, mean leaving the ovaries or one ovary. You're going to be making less estrogen than you would have. If you get a full hysterectomy, that means you're taking the ovaries and the uterus out, and those are the main source of your body making estrogen. So you will have a significant drop, maybe almost to zero, but your fat cells in your body actually store estrogen hormones. So you will have some estrogen from other parts of your body, but it won't be enough to where you're able to function without the symptoms that we talked about earlier.
Okay. Let's see. Um, Once you start hormone replacement therapy, will you have to continue forever to keep symptoms from presenting?
I'm going to go with yes. So I can't delete this beautiful arrow that was provided for me.
Let's
But
see if I can get rid of it.
if we, it's fine. It's fine. So if we have a curve, and this is, I'm going to say this is 19 years old. That's usually when we have a lot of hormones, and I'm going to say this is 120. If we live to 120. So we start off, our hormone levels are up here, and then as we get older, and stress, stop. Stress will reduce your hormones, but as we get older, naturally, we got some zigzag in here, right? And then you go down. So depending on your genetics, the way your cells and receptors are made, determines how, at what point, you actually feel this drop. Um, if we gave you hormones, the hormone optimization, so that means an optimal level back here. Uh-oh, Pamela. Back here, I would, no matter what age you are, so just say, for instance, your age is in here, then I would take this level and fill in the gap, right? So now your hormone level is where it was when you were 19. All right. And so then you say, you know what? I don't really feel like I need to continue to do this for some reason. I've been doing it for 5 years and now, I just want to stop, or you move or whatever, right? So then 5 years from then, you're here, you're not taking any extra hormones, and then you're going to be here. Your hormone level is going to be there. Does that make sense? So you're going to be where you naturally would have been before you start taking any hormones. So if you're okay with that, that's fine. It's not going to cause any harm, but we talked about what happens when you don't have this appropriate level of hormones in your body or hormone balance, when you're going to start getting weight gain, the abdominal area, the hot flashes, the increased risk of diseases harming you, things like that.
Okay. So I see a couple of questions. I think we've answered them already, or if for some reason we have not and you want to clarify what you're asking, please let me know and you can ask it directly off of mute. Someone asking if they're on estradiol patch, what happens if I stop? I can tell you what happened. The symptoms are going to come back. I don't have to be a doctor to tell you that because I went through that.
Yeah.
They're going to come back.
Um, yeah, the estradiol patch is a synthetic hormone, so it's not bioidentical. And so many patients that I have that come to me on the patch, they don't have complete symptom relief. And it actually is possible for you to have complete symptom relief. So usually with the synthetic, there's a partial improvement, but you don't really get the best benefit with the synthetic hormones. The patch is better than the pills, just because it does not go through the liver. So there's a what we call first pass effect. But in addition to that, there's also other issues that come up with the patch, like it not sticking, if you're still sweating, and some people don't want to see it, and then you don't necessarily have complete symptom relief as well. Anything else? We're getting close to the time. But
We got 5 more minutes. We were going to go stop at the top of the hour, guys. Okay, so there's a question. My doctor had me to change it once weekly as opposed to twice. Uh,
it sounds like a very specific
yeah,
personal question.
yeah, that's
You can always reach out for individualized consultation if you want.
Okay. And then there's another one. I'm not sure if this is too personal too. It says, I suffer from PCOS. Should I consider taking hormones soon?
Yes, actually. So
Or
PCOS,
for those of us that don't know, what is PCOS?
so PCOS is actually a hormone imbalance. Imagine that. So so actually I'm just gonna pull up my little screen again, my little whiteboard thing. Okay, if I can get to it. Okay. So PCOS is a I think I broke my computer. I can't do it. So PCOS is actually a hormone imbalance, and patients are treated with that effectively. The issue that I talked about before, where your body stops reproducing or stops wanting to reproduce because of a stressful um, chronic stress, so long-term stress, it actually impacts your ability to reproduce. And your ovaries normally would um, they hold your eggs, right? So you have ovaries or eggs in your ovaries, and your hormones on a rhythmic basis monthly signal the ovary to release the egg. And so for some reason, hormone imbalance is causing the egg not to be released. And so hormone replacement therapy is actually beneficial for that. Um, if you're, it would be a little bit of a personalized case if you're trying to get pregnant in the future, but hormones can definitely help with that. Also, stress reducing activities can help with that as well, in addition to some other medications, including metformin. So,
Okay, so I think we're at the top. We're at the end of our session for now, guys. Thank you so much for all your questions. I think they were
yes,
good.
thank you.
Yeah, we hope this was helpful and answered some of your questions that you had about hormones. If you want to contact me regarding coaching questions, you can send me an email. I can be reached at info@executeyourpower.com. And my number is 615-200-8861. If you want to reach out to Dr. Poe for any additional information, she can be reached at info@cryoandcontour.com, or you can call her at 615-819-2201. I guess I can put that information in the chat. Let me see if I can copy it real quick from my notes and add it to the chat for you guys to be able to have it. But also, please, before we close this out, if you can think of any topics that you think would be useful for us to try to cover and talk about in the future, please let us know. Um, let's see, copy. Trying to do two things at one time. Copy and paste. Let's see. Okay, I'm gonna say me, Kathy Davis. Okay, so now the information is gonna be in the chat for you.
Perfect. Thank you so much, Kathy.
Yeah, good job. So I think I got an email from everybody that joined this session. So if that worked and it's okay and it went through okay, this was recorded. So I do plan to send it out and share with you guys so you can have it. If you want to share it with somebody else that wasn't able to join the session, please feel free to do so. We do want to do, these in the future more on topics Dr. Poe has a desire, both of us has a passion to help women and in just for longevity, period, and living healthy lives. And this is just one subject of many that we can cover
Living
and talk
healthy
about.
longer, right? Because
Right.
sometimes there's this actual speaker I listened to, and he was like, when you're 80, what's your goal for you when you're 80? Like, what do you want to do? And he was like, do you want to like be able to get up off the floor?
Exactly.
Or do you want to run a marathon when you're 80? Like, what?
Exactly.
So you have to start now, actually. We can't wait till we're 80 and then say, oh, I got to try practicing getting up off the floor. We have to look into things that are going to help prevent, keyword, any weakness and disease and illness, and so that we can be healthy longer. Because it's one thing to live long, but we want to be healthy as we age.
Okay, topic management of symptoms of menopause in breast cancer survivors. Ooh, good topic.
Good one.
Good topic.
There are resources, actually bioidentical hormones and estrogen blockers combined. There's research going on. You might be a candidate for a research study. The only problem with being a candidate that you might not get the medicine. You might be on the placebo side. So, but yeah, there's options and non-hormonal options too.
Okay. All right, ladies, thank you guys for joining us. We appreciate you spending the time with us this evening. We hope this was useful and beneficial in some form or fashion, and wish you guys have a great evening.
Thank you.
See you soon.
Night.